A heart monitor, also known as an electrocardiogram, ECG or EKG monitor, works by detecting and recording the electrical activity of the heart. Here's a detailed explanation of how it functions. Electrode placement. Small adhesive electrodes are placed on the skin at specific locations on the chest, arms, and legs. These electrodes are conductive pads that detect the electrical signals produced by the heart. Signal detection. The electrodes detect the tiny electrical changes on the skin that arise from the heart muscle's electrophysiological pattern of depolarizing and repolarizing during each heartbeat. Amplification. The electrical signals detected by the electrodes are very small, so they need to be amplified. The heart monitor contains an amplifier that boosts the signal strength so it can be recorded and analyzed. Recording. The amplified signals are then recorded and displayed as waveforms on the monitor. Each waveform represents the electrical activity of the heart during a heartbeat. The main components of a typical ECG waveform are: P wave represents atrial depolarization, the atria are contracting. QRS complex represents ventricular depolarization, the ventricles are contracting. The QRS complex is usually the most prominent part of the ECG. T wave represents ventricular repolarization, the ventricles are relaxing. Analysis. The heart monitor analyzes the waveforms to assess the heart's rhythm and electrical activity. This can help diagnose various heart conditions such as arrhythmias, heart attacks, and other cardiac abnormalities. Display and storage. The results can be displayed in real time on a screen for immediate analysis by healthcare providers. Additionally, the data can be stored in the device's memory or printed out for further review and long-term monitoring. Types of heart monitors. 1. Holter monitor, a portable device worn for 24-48 hours to continuously record the heart's electrical activity. 2. Event monitor, similar to a Holter monitor but used for longer periods, weeks or months, and typically records only when the patient activates it during symptoms. The telemetry monitor, used in hospital settings for continuous monitoring of patients with data transmitted wirelessly to a central monitoring station. 4. Implantable loop recorder, a small device implanted under the skin that continuously monitors heart rhythms for up to several years. Heart monitors are essential tools in cardiology, allowing for the detection and diagnosis of various heart conditions, guiding treatment decisions and monitoring the effectiveness of interventions.